about his or her daily life, having a normal sex life, but then through sexual contact, they can unknowingly spread the disease to even more people. And then once it's spread, that one person who is also infected can spread it onto even more people. And so this leads in an exponential increase of HIV patients. And all of them, well, most of them won't even know that they have it unless they somehow get tested for it, which is really hard to do if you don't have any symptoms. So this is why it's so scary and why it's such a serious problem. Yeah. So during the period of time, the 8 to 10 years where you don't see any symptoms, the virus multiplies itself. Well, you won't know that is happening, but the HIV virus multiplies itself and starts destroying the immune system. And after those 8 to 10 years are up, you'll start seeing symptoms again, such as a fever, chills and diarrhea, weight loss, insomnia, etc. But then, again, these symptoms are not really symptoms that you can associate with HIV or AIDS, or that most people would associate them with. That is, most people won't suspect that they have AIDS, even if they get these symptoms, because these are really common symptoms. So these are some of the infections that result as a result of AIDS. So after you get AIDS and after your immune system is weakened, you can get these results, these infections, such as tuberculosis. 37% of AIDS patients have them, and herpes, 11% have them, respiratory pneumonia, 22%, and candidiasis, 12%. So basically, AIDS causes you to be more susceptible to other dangerous infections. And this is how AIDS can kill people. So this is just a picture of the symptoms. So leukoplakia. This is mold growing on the tongue, white mold. And this usually doesn't happen unless a person's immune system is so weakened that they can't even fight off mold on the body. And skin cancer. Skin cancer. There's things growing on the skin. Candidiasis, so more mold on the tongue. And retinitis, CMV, also known as cytomegalovirus. And this is what happens to your eye. And HPV, human papillomavirus, herpes infection, and herpes simplex virus, so there's something growing on a person's mouth. Herpes again. Kaposi sarcoma, so there's small bumps growing on all over the body. And as you can see here, when these bumps get severe, they often cause damage to the skin and also to the gums inside the mouth. And extreme weight loss. So this is a picture of an AIDS patient who suffered from extreme weight loss. And molluscum contagiosum, so bumps growing on the skin. And pneumonia. And Cryptococcus neuromans. Can't read that, but this is basically a disease related to the brain. And tuberculosis. So basically, all of this just shows that there are many symptoms, or there are many infections that can arise as a result of AIDS. Before there was skin cancer and tuberculosis, these are all serious diseases, and this shows why AIDS is such a serious problem. Because if you get it and it's too late, like if you don't get tested for it and it's too late, then you'll probably develop some of these infections. So HIV and AIDS testing. Now I'll talk about getting tested for HIV and AIDS. You can't make a diagnosis based on clinical symptoms. So what this means is you can't say to yourself, oh, I don't have HIV or AIDS because I can't see anything wrong with me, because you're not supposed to see anything wrong with you. as I mentioned before, for about 10 years you won't see any symptoms. So you can't say that you don't have AIDS or HIV just because you can't see any symptoms. The only way to know for sure is by getting tested. So yeah, you have to get tested. You can't make the judgment. You can't say whether you have the disease or not just by looking at yourself. So you have to get tested. But then a lot of people don't get tested because they have something called an AIDS nervous breakdown. So they're afraid that they might actually have the disease. So when they get tested and the results come out, they're afraid that they will have the disease. And so they rather just not know the truth. And they'd rather just be ignorant. So yeah, this is why some people just don't get tested for AIDS. And then so these are some various places where you can get tested for AIDS and HIV. One place is a public health center, and another place is a hospital and a clinic. And there are also several NGOs, non-governmental organizations, that help support free testing of HIV and AIDS. And one such NGO is the Korea Alliance to Defeat AIDS. And what they do is basically they test your blood, and then within a few hours you'll know whether you have the disease or not, and it's completely free. So yeah, what this means is oftentimes when you're receiving a blood transfusion or you're donating your blood, they often check your blood to see whether there's anything wrong with you. So when you're donating your blood, they often check your blood for free to see whether you have any diseases, certain major diseases. But then you can't know whether you have HIV or AIDS or not through that free testing when you're donating blood or when you're receiving blood transfusion, because these tests are often simple and they don't test for HIV and AIDS. They might test for other serious diseases, but they don't test for HIV. So you have to specially get tested for HIV and AIDS. So this is when you should get tested. Let's say you think or you're suspecting or you're wondering whether you have the disease. So let's say you did something and then you're afraid that you have the disease. Then you should get tested for HIV or AIDS approximately 12 weeks after the day you think you got infected. And the reason for this is because HIV tests result on antibodies. So antibodies in the body. So when HIV cells first enter the human body, antibodies are formed. So the body attempts to fight off the cells by creating what are called antibodies. And then the HIV test basically checks to see if you have these antibodies, whether you develop them or not. But then these antibodies are formed 6 to 12 weeks after initial infection. So this is why you should get tested about 12 weeks after you think you got infected. And you shouldn't get tested right away. So there are several test methods of HIV and AIDS, such as the PA method, the LISA method, and the rapid test method. But then there's also the HIV antibody test. So this just basically tests to see whether your body developed antibodies against HIV. And excuse me. And there's other testing methods such as HIV PCR, HIV NAT. So now I'll talk about HIV treatment, HIV and AIDS treatment. So there's various types of medicine that help you get treated for HIV and AIDS. But then oftentimes people take a lot of types at once, because when different types are taken at a time, this may actually be beneficial. Like oftentimes you shouldn't take different types of medicine at once because it might have conflicting effects or results on your body. But then in the case of HIV and AIDS, what we're finding is that when taken continuously, there's actually it's more beneficial. There's actually a more beneficial effect. And So yeah, what these medicines allow you to do is, when you take medicine for AIDS, you basically, there's maintenance of immune functions, so it strengthens your immune system, and also it suppresses virus multiplication. So the HIV virus multiplies, but it multiplies at a much slower rate, so it slows down the infection of virus cells. And also it suppresses virus tolerance, so it raises immunity against the HIV virus. So the medicine is effective because it strengthens your body, your immune system, while at the same time weakening the HIV virus cells. So this is how HIV treatment works. And what's important to note is that the treatment doesn't completely get rid of HIV and AIDS. So just like diabetes, if you get it once, then you basically have it for life. You can't get rid of it. But then what you can do is maintain a healthy lifestyle, because if you take the medicine, then this will greatly slow down the disease, so it won't have much of an effect on your daily life. Like, my grandmother has diabetes, and what she does is she gets injected with insulin every day, but then as long as she makes sure to do that, there's no negative effect on her daily life. So likewise, AIDS patients, they'll have the disease for life. But then, if they just make sure to get treated and take medicine, then they won't have a disadvantage in their lives. So these are the best ways to prevent HIV and AIDS. So one way is to use condoms, because this greatly, as you know, 99% of HIV or AIDS patients contract the disease through sexual activity. So condoms greatly reduce this risk. And also another way is to participate in sexual activity at an older age. So you should start having sex when you're older, when you're more responsible and more mature to make wiser decisions. Because usually when you're younger, we often tend to do things without thinking over it. But then if we're older, then we'll have wisdom to make better choices, hopefully. And finally, a third way is to reduce the number of sexual partners. Because, yeah, if you limit the number of sexual partners, then it'll greatly reduce the risk of you contracting the disease. So now that I've talked about AIDS and HIV and what it is, I'd like to talk about some of the human rights and the human rights issues regarding AIDS patients. So this is basically a survey of HIV-infected people, so people infected with HIV, and this shows that 25.4% of HIV patients in Korea are unoccupied. So they've given up searching for work. And this is often because, as I said before, employers, they often pressure the patient to give up. And then so they are unable to find work, so they just gave up trying to search for work. And 18.3% are unoccupied, but they're currently trying to find work. But most of them are unsuccessful because of the extreme bias and discrimination in Korean society. Employers are often hesitant to give job positions to HIV patients. And 2.5%, they're unoccupied because they're either elderly or they're married, they're housewives. And 53.4% are occupied. So most of the HIV patients who are occupied, they don't reveal their status, or they don't reveal to other people that they have the disease, or else they'll be pressured and they might lose their jobs. So this shows that approximately half the people who have HIV in Korea are unoccupied for many reasons. They don't have jobs because they just either give up or they're pressured to quit. So they basically lose their jobs by force. So yeah, this is a sad situation because when a person doesn't have a job or and a family, then that person will really be unable to take care of themselves. And so it just shows that the discrimination that people face. And this is a survey of the most difficult part of everyday life. So people asked HIV patients what they thought was the most difficult thing that they have to face in their everyday lives, and 25.1% said economic difficulties. So a quarter